All right, let's talk about something that so many people with peripheral artery disease deal with: getting a good night's sleep. If you're tired of those nighttime aches and cramps, you're in the right place. We're going to break down how a few simple adjustments to your sleeping position can support better blood flow and, hopefully, bring you some real relief. So let's start with the big question, the one that probably keeps you up at night, literally. Why is it that you might feel okay during the day, but the second you lie down to sleep, that aching, cramping, and burning sensation kicks in? What is actually going on here? Well, to get why this happens, we first have to understand PAD itself. The highway analogy is perfect. Your arteries are the highways for your blood. Now, during the day when you're moving around, your leg muscles are constantly contracting. They act like little pumps, helping to push blood through those narrowed construction zones. But at night, your muscles clock out. They're at rest. And when those muscle pumps stop working, a few other things happen. Your heart rate slows down, your blood pressure drops, and overall circulation just gets a little more sluggish. On top of all that, when you're standing or sitting, gravity gives your blood a nice little push down to your feet. But when you lie flat, you lose that assist. It's really a perfect storm that can leave your legs starving for that oxygen-rich blood. And this leads us to something really interesting, which you could call a circulation paradox. Because the most common piece of advice you hear for circulation problems, elevate your legs, can actually make PAD symptoms a whole lot worse. Okay, so check this out, because this is the key difference. For venous issues like varicose veins, the problem is getting the used, oxygen-depleted blood out of the legs and back to the heart. So elevating them uses gravity to help drain that pooled blood. But with PAD, it's the exact opposite problem. The goal is to get fresh, oxygen-rich blood into the legs. When you elevate them, you're making your heart fight against gravity to pump blood uphill through those already narrow arteries. And the risk here is no joke. Forcing an already struggling circulatory system to pump blood against gravity can actually worsen the pain by further starving your limbs of oxygen. And this has a name: ischemic rest pain. So, if elevating can be a problem, what should you do? Well, the goal is to find a position that works with your arteries, not against them. Let's walk through some of the best options, kind of ranked for different levels of PAD. Okay, first up, for those with just mild discomfort. Now, I know what you're thinking. We just said elevation can be bad, but a slight elevation can sometimes be beneficial here. It can help reduce any swelling you might have, and in these milder cases, the benefit of reducing that fluid buildup can outweigh these small challenges to your arterial flow. It's really all about finding a balance that works for you. Now, if you are going to try elevating, doing it the right way is absolutely crucial. You want to lie on your back, use a couple of pillows or a proper wedge, and aim for about 6 to 12 inches of height. And this last part is key. Make sure your knees have a slight bend in them. You don't want to lock them straight, because that can put a ton of strain on your hips and your lower back. But what if elevating just doesn't feel right? Or hey, maybe you just hate sleeping on your back. No problem at all. Side sleeping is your next best bet. This position takes pressure off your major blood vessels, and sleeping on your left side in particular can even improve your heart's efficiency. And the one simple trick that makes side sleeping a total game changer is just putting a pillow between your knees. It sounds so simple, but this little addition does so much. It keeps your spine aligned, which is great for your back, and most importantly, it stops your top leg from pressing down and compressing the blood vessels in your bottom leg. Now, for more severe cases of PAD, this is where that paradox we talked about really comes into play. The logic completely flips on its head. Instead of elevating, some people find relief by making gravity their friend, letting it help pull that blood down into the lower legs and feet. And this isn't just a theory, it's a powerful effect that doctors see all the time. In the most severe cases of PAD, something called critical limb ischemia, patients will instinctively just hang their leg off the side of the bed to get some relief from the pain. Now, it's not a great long-term solution because it can cause a lot of swelling, but it perfectly shows how you can use gravity to your advantage when circulation is really compromised. Okay, so we've covered the helpful positions. Now let's flip it and talk about what not to do. The positions that can actually create new roadblocks for your circulation. First, sleeping on your stomach. It's generally not great for anyone since it can twist your neck and spine, but for PAD, it can also impede your overall blood flow. And this next one should probably go without saying, but avoid crossing your legs or curling up into a super tight fetal position. Both of those things directly compress your arteries and veins, exactly what you're trying to prevent. Your sleeping position is a huge piece of the puzzle, but it's not the only piece. Your entire nightly routine can play a massive role. So let's look at a few simple habits you can build to promote better circulation all night long. These are all so simple, but they are seriously powerful. Keeping your feet warm with socks actually helps your blood vessels dilate or open up. A little gentle stretching can do wonders for preventing cramps. And definitely try to avoid stimulants like nicotine and caffeine later in the day. They are known vasoconstrictors, which is just a fancy way of saying they tighten up your arteries. Okay, and this is really, really important. All of these tips can absolutely help you manage your symptoms, but it is critical to know when you need to call a doctor. PAD can progress, and getting treatment early makes a huge difference. So please be on the lookout for these red flags. If you're having constant pain even when you're resting, if you notice your feet are looking pale or bluish or just feel really cold, or if you have any sores on your feet or toes that just won't heal, those are all signs that your situation is getting worse and you need to see a doctor. And I really want to land on this point because it might be the most important thing we talk about. If you ever experience a sudden, severe pain in your leg, and the leg also becomes cold or pale, that could be a sign of a sudden blockage. It's called acute limb ischemia, and it is a medical emergency. You need to get help immediately to save the limb. So what's the big takeaway here? At the end of the day, managing nighttime pad pain is all about working with your body, with physics, really, instead of fighting against it. By listening to your body and choosing the right position for you, whether that's slightly elevated, neutral on your side, or even lowered, you can turn gravity from an enemy into an ally. And that simple change could be the key that unlocks a much more comfortable and much more restful night's sleep.